Yeah. For our purposes, yeah, for sure. Yeah. Lots of sounds to it. Okay, I don't want to ruin it then. Okay. Oh, it doesn't matter. It's, yeah, I mean, yeah, if you want to go, I mean, it doesn't matter. We'll have you and I don't care. Do you guys care who goes first?
I can go first. I probably should just get it.
Yeah, we'll have one of you two go first, and we'll have Becky go last because hers is actually like part of this chapter.
Okay.
But definitely go have you go first because you're up here. You'll click on if you're ready.
Yeah.
Okay, click on this to start the presentation when you're ready, and then you can use the clicker to click to get through the slide.
Yeah. Talking about Giardia today. Giardia is also referred to as Giardia lamblia and beaver fever. It's a protozoa. It's unique in appearance because it has a unique, like it looks like a heart and it's symmetrical. They kind of look cute, but they're mean. They're protected by their shell, the cyst. I thought this is kind of interesting. They come into your body as a cyst, and then they separate, and then they leave your body. They regain its shell and leave your body as a cyst. They attach to the intestinal epithelium, and it feeds on the mucosa. So because of this, it makes it hard for the host to absorb their own nutrients because these giardias are like super greedy and they eat all your nutrients. Transmission happens from person to person or with contaminated surfaces or food. So you can see kind of what I was saying. It starts as a cyst, and then you get it from like dirty drinking water or public swimming pools, and then it goes into your intestines. And down here, it kind of gives like a more specified where that shows how it starts as a cyst, then it splits, and then it ends up as a cyst where you poop it out. That's the mode of transmission. And this, I just thought it was important to see like how it moves. So I wanted to add this video. I didn't pick the music, but I thought y'all might want to see how it moves. So they're like very modal and they move pretty fast. But okay, risk factors are children, and if you're a caretaker, especially if you're wiping babies' bottoms or at a healthcare setting, you have to help wipe people. People are also at risk if you don't have safe drinking water or if you travel to places that don't have sanitary conditions or well water. I have a well at my house, so we have well water, so I get bottles of water. So it makes me nervous for showers, I guess. And then also people who have anal oral sex are at risk of getting it. Preventative measures are washing your hands and then using gloves, like when you're changing diapers and everything. And then also sexual protection, such as condoms. And then also cleaning surfaces regularly. And then I read that vinegar is effective on helping kill Giardia, which is neat because it's natural. Some of the symptoms are like bloating in this picture, and then you have gas, and then like Bernie, you can burp a lot, and then feeling nauseated. And also if you have like fat in the stool, this picture is what it looks like when you have fat in your stool. It's kind of a yellowy color. And then you have like stomach cramps and also feeling like really tired a lot. Differential diagnosis is diverticulitis and appendicitis, also GERD and pelvic inflammatory disease and gallstones. They all have similar like stomach issues as what happens whenever you do get infected with Giardia. And then the diagnostic methods are an ELISA test right here, and then the direct, I thought this one was cool, the direct immunofluorescence assay. That's this one. It's like glowing and everything. And then also the microscopy trichrome staining, which is this one right here. And then we have the rapid assay test. And those are ways that it's diagnosed. Patient care and treatment. The most common treatment is antibiotics. Metronidazole is the most common one used, and then also tinidazole is used. And if it doesn't go away on its own, because it can, but if it doesn't go away after 6 weeks, then the internet said to seek medical treatment. I'm not a doctor, so I can't really say that. But patient care and treatment. This is more of like holistic or over-the-counter stuff. Pepto-Bismol helps just with like the stomach crampings and the gas. And then also natural like yogurt, probiotics, and then cinnamon and ginger are supposed to help. And then also what I was saying earlier, apple cider vinegar, that helps calm it down. And then speaking of apple cider vinegar, and we were talking about it earlier, I just have one last video. It shows you what happens when it interacts with vinegar. So I thought it was cool. I thought you might want to see it. So that was in That's it.
The name of it, Borrelia burgdorferi. Yeah, you're okay. Like I said, I'm not gonna like count you guys off for mispronouncing a thing. Just try it and you're
Just use
fine.
the arrows.
Yeah, the arrows, or you can just with the mouse.
Okay.
Or space bar.
Okay, so I'm doing mine over Lyme disease. Lyme disease is caused by a bacterium called Borrelia. What did you say? Burgdorferi. It's a complex of gram-negative bacteria. The structure is like corkscrew shape. It is a fastidious, slow-growing bacterium. Lyme disease is contracted by an infected tick bite. They usually come from deer ticks or a black leg tick, and they're pretty much located in the north central US. The risk factors for Lyme disease, they love to, well, ticks live in woody areas, grassy areas. They love the exposure of skin. When you get bit, you have to remove it immediately. Those are places to avoid: woods, campgrounds, grassy areas. Symptoms, if you get bit by a tick, it's like common cold symptoms, but you get fever, headache, chills, fatigue. The diagnostic testing, they use the ELISA test. They do a blood test to determine the antibodies, and then they do the Western blot test to see if the ELISA actually detected antibodies. The treatment is usually treated with doxy and amoxicillin. Those are the most effective. Usually treatment is 7 to 14 days, depending on the severity of the bite. This is just some other information. If it's not treated, you can get the bullseye rash, which cause inflammation in the heart, leading to a heart blockage. And that is it.
Yeah, it updated it after I had downloaded it, but you're all right. I got your slides, so you're fine. All right. This is what I want, but this is what I want to go away. There it goes. Okay. I can actually make this full screen. Full screen, close that. All right, and you should be able to use the arrows for that one.
All right, you guys. So gonorrhea, as we already know, is a sexually transmitted infection. It is, hang on, let's see. Sorry. It's okay, don't worry about it. Okay, so gonorrhea is caused by a gram-negative diplococcus by the name of Neisseria gonorrhea. It is considered to be an obligate pathogen, and it is the second most commonly reported sexually transmitted infection. This slide here is just going over taxonomy, which I'm not going to go over. We have virulence factors, which include, it has pili that help it adhere to the host mucous membranes. It also contains outer membrane proteins as well as enzymes. One of the enzymes that it has is IgA protease, which breaks down our IgA antibodies. And then it also has the LSO. I'm not really sure how to say that, but that one there is a glycolipid, which gives it the capability of changing its structure so it can present itself differently. It also has efflux pumps. Those pumps are able to take out the antibiotics that the patient's taking, as well as removing the host's microbes. Modes of transmission. So, it is transmitted through sexual activity involving vaginal, anal, or oral sex. It can also be transmitted through delivery of a mom that's infected to the baby, as well as innate objects. I thought this was pretty gross and interesting all at the same time, that it can live on innate objects for like an hour to 2 hours after being exposed to it. Symptoms for men include burning and pain during urination, as well as swelling of the epididymis, discharge, and can lead to scarring. Females, they can have the pain and irritation during urination, as well as increased vaginal discharge. Their discharge is a little bit different. It contains mucus. It can also contain blood. Unfortunately, this can cause vaginal bleeding in between periods. And then if you got the disease orally or anally, it will cause a sore throat, pain or burning or bleeding during bowel movements, rectal discharge, and itching. Interesting fun fact is 10% of men are asymptomatic, where 50% of women, which is scary, are asymptomatic. It is often diagnosed differently it can be diagnosed as syphilis, chlamydia. I have this word written down, trichomoso. I don't know. Anywho, next one, UTI, the mycoplasma genitalium infection, as well as vaginitis. Diagnostic methods include PCR, gram stain, nucleic acid amplification, hybridization, ELISA, and isolation. Treatment for gonorrhea is somewhat limited, I would say, because it is very much antibiotic resistant. Currently, right now, there are no vaccines, and CDC recommends that patients take erythromycin as well as ceftriaxone together to help fight the infection. Over-the-counter medications would help you with your pain and inflammation. Warm compresses, refraining from sex, staying rested and hydrated would help you as well. Prevention, avoid sexual activities, try to not have sex with multiple people all the time. And if you are, definitely wear a condom. You should probably get tested regularly if you do participate in that. You should definitely also complete all of your antibiotics and wait 7 days after before you have sex again. They also say, because again of the antibiotic resistance, that you should go see your doctor again just to make sure that the infection has been cleared up. And if you have been diagnosed, let your partners know that you've been within the last 60 days. Like I was saying before, major causes for concern, gonorrhea is ridiculously resistant to antibiotics. This started back in the 1940s with sulfonamides, the 1970s and 80s with penicillin, the 1980s with, I can't think of the word right now, tetracycline. 2007 was the fluoroquinolones, and 2009 was the cephalosporins. While I was doing my research on this, I found an article, which it says it's here, but from this calendar year, and in England, they've already had 31 cases of the antibiotic resistance for the ceftriaxone. So super scary. Definitely get yourself tested if you're having sex with lots of people. That's it.
Let me make sure I get people that are online counted as. I'll put this back out too for those of you that may not have signed in yet. I just don't want to miss these guys before they log out. Students, present. It's everybody, yeah. Okay. Okay, so let's do this. The diseases of the genitourinary system. So we're going to talk a little bit about the structures of these first. We pretty much know like the gist of what we're going to need to know for these diseases, but these diseases, when we're talking about like the actual urinary tract ones, can come from either side essentially. So they can come from the bloodstream and then move into our urinary system, or they can come from the urethra and basically enter from the exit. Either way, understanding the fact of how tightly knit the relationship is between the kidneys and the bloodstream kind of puts into perspective the risk of the crossover there. If you're coming in from the urethra, then you have to get through the bladder and then through the ureters and then up into the kidney and then from the kidney into the bloodstream if you're going to be causing sepsis or something like that. However, because the kidney is so important for filtering out blood, the risk of moving from kidney into bloodstream is super high, as well as the effects of any inflammation from and kidney infections can be extremely damaging for the kidneys, and that can be permanent and need to have a kidney transplant due to damage potentially from some of these diseases. And yeah, so then going down, it's the same sort of thing. If you have a blood infection or you have a kidney infection that could potentially come from bloodstream, you have to go through the ureters to get to the bladder. There's a couple of diseases that kind of go that way. So we'll keep that in mind. For protecting your urinary tract, we have the flushing action of the urine, which actually is pretty successful at keeping microbes out of the system. We have desquamation. Anytime you guys hear that desquamation, we're talking about getting rid of the cells that are on the surfaces. So just shedding the cells just normally. You shed those cells, just like you shed your skin cells, and the microbes that are attached to them will also get shed. Bacteria that are usually adapted for the GI tract don't have to worry about as much of the flushing action. So most of them can't adhere well to the surface of the urinary tract. However, we've already met the diffusely adherent E. coli in the previous chapter, so we kind of know what to expect for that. But that's how come E. coli can become our number one cause for urinary tract infections. We have the acidic pH of urine, presence of lysozyme that breaks down peptidoglycan in the cell wall, lactoferrin that kind of hoards away all the iron so that the microbes can't use it, and then secretory IgA. Again, we have so much mucosa in our body, and anywhere you see the mucosa, to protect the mucosa itself, that IgA again is way more important than IgG. IgG will be for your bloodstream more or less. This will be good for your mucosa. We get into talking about the effects of the reproductive system from these diseases. We don't even need to know the whole anatomy of either of the reproductive tracts for males or females, but you might want to understand like the routes that we might be getting exposed to infections. So talking about the urethra in men being longer than that in females, that makes a difference when we're talking about urinary tract infections. We're going to talk about the effects of circumcision, because having the skin there creating a moist environment creates a different flora. And that might not necessarily be a bad or a good thing, it's just different flora. And some of those flora usually relate to being more susceptible to inflammation. And if you're more susceptible to inflammation, you're more susceptible to getting certain STIs. So being uncircumcised actually makes you at a greater risk for getting these things. It has nothing to do with cleanliness or anything, just your normal biome that would be associated with it. So that's important to remember. It's important to remember too that when we talk about the urethra of men, that it could go up and cause bladder infections, but we also have connection from that urethra into the prostate gland. So infections that can travel into the bladder can also travel into the prostate. For females, again, we know that the entry into the bladder, that urethra, is much shorter, so it's less distance for it to have to travel to cause contamination in the bladder itself, so have full bladder infections, which is actually why we see this as being more common in females than we do in males. We'll talk a little bit about these STIs, but as far as structures that would be involved, it could involve any part of our the female reproductive tract, but a lot of these are going to be affecting usually the vagina or the uterus, the fallopian tubes, as far as what inflammation can be caused by these, as well as external inflammation on the labia. So let's talk about the defenses in the female tract. This is obviously going to vary over lifetime, especially considering hormone fluctuations relating to mucus production, menstruation, and all these things. Even in just the cycle from roughly month to month of hormone cycles, those things can affect your flora. just within those cycles, let alone the overall, evolution of the body coming from being a baby, your first exposure to microbiome, growing up, then reaching puberty, having pH change go on in the reproductive tract. All of these things can change from those hormone productions, and then exposure to, sexual partners, introducing new flora. And then after that, menopause, causing more, again, different changes in our hormones that can cause fluctuations in our biome as a result of response to that. It's, yeah, we were kind of talked about that, the circumcision and the short urethra. So for men, their biomes tends to be pretty similar to what we see in the female biome, which is going to be lactobacillus species and streptococcus species. Again, pretty common what we see in general. The lactobacillus, the lacto is the lactic acid producers that give us that acidic pH in the genitals for both men and female. Doesn't make, actually, I don't know what I'm trying to say there, but when we have exposure of men and women, or men and men, or whatever it is, exposure of new people's biota from sexual contact, it tends to be the reason why we have pretty similar biota, just maybe in different percentages once we start having sexual contact occur within populations. So men who engage in vaginal, anal, or oral intercourse can then harbor bacteria from those encounters and then produce vaginosis in females. So a shift in the populations of bacteria, and it just could be introduction of more bacteria, different strains of bacteria, different species, and whatever it is. But the new bacteria from the sexual encounters can lead to overgrowth and infection of those bacteria. We call that bacterial vaginosis, and we'll get to that in a little bit. But again, a lot of this is going to relate in the female tract to hormone fluctuations that can lead to changes in the flora themselves. Candida albicans is yeast. It is what causes yeast infections. It's normal to have it as part of the biome, but we don't want it to overgrow, like take up too many stadium seats, right? Because then we can see presentation of disease. For urinary tract infections, cystitis is talking about infection within the bladder. Pyelonephritis, we have infection of the kidneys, and then urethritis is just in the urethra. So these terms are just going to be relating to how far the infection has gone within the urinary tract. And the inflammation is usually what is causing any bleeding and damage to the tissues and things like that. 80% of UTIs are caused by E. coli. For women, this is going to be usually E. coli from your own biome. So that's something to keep in mind. So it could be any of them, but primarily E. coli would be the guy that wins out, particularly because he has that diffusely adherent factor to survive the flushing. We also have other kinds of UTIs that are associated with being catheterized and things like that. So those will be different microbes. Moving on to leptospirosis. This is a bacterial disease. It's a zoonosis. There is a vaccination available for pets, so you can prevent this from getting spread amongst pets. It has two different phases of infection, just depending on how and where the immune response essentially is, or how or where the organism is and how are you reacting to it. So you could have just feeling sick, kind of normal sick symptoms, where the pathogen will be in the blood and the cerebrospinal fluid, but we'll just have these symptoms of the fever, the chills, headache, muscle aches, and vomiting and things like that. But if it shifts towards that immune phase, now you aren't having as many of those typical sick symptoms, but you will have meningitis potentially, kidney and other tissue invasion that can lead to damage of the tissues. That's called Weil's syndrome. So it just, like I said, just depends on where that pathogen is and how your body is kind of reacting to it as to what phase you're in for this. The damage that's done by the inflammation in response to that can lead to long-term disability and death. So like I said, bacteria, it's a spirochete. It has adhesins that allow it to stick to things. It also has a little hook on the end, like a lot of spirochetes have, to help it attach to the cells. So yeah, it actually can penetrate the cells themselves. So this one isn't an extracellular bacterium, it's an intracellular one. Shed in urine and feces, so contaminated soil is usually where this is going to be picked up. All right, we've talked about the schistosomes and how they can get in through your intact skin whenever you are swimming in water that's contaminated. We had a snail, like middle life cycle thing for those guys, where like someone who has it pees or sewage gets into the water, and snails then get infected with the larvae, and then they can release another cycle of life of larvae that can go in through your skin. And so that's how that cycle will work for schistosomes. But however, this particular species of Hematobium schistosomes, these guys will prefer moving into the bladder, and they can actually cause obstruction of the bladder and damage of bladder tissue. That's usually later on in the cycle of the pathogenesis after it's invaded other tissues of the body and the bloodstream and everything like that. So again, same like the other schistosomes, it can coat itself in blood proteins from the host to hide from your immune system, and we'll give you praziquantel to treat. All right, so vaginitis is different from vaginosis. Vaginitis, we have actual inflammation of the vagina. There are 2 organisms that we need to know that can cause vaginitis, and that's really the only symptoms they're going to be associated with is vaginitis, okay? And, you know, discharge and things that might come along with that, but they don't spread outside to the other parts of the body typically. They can, but these are their like original main presentation is just vaginitis. So inflammation of the vagina, we have yeast infections caused by Candida albicans, so overgrowth of normal biome, usually from taking antibiotics for anything, and then killing off those normal lactobacillus species. Now we can have the yeast overgrow, so it's called superinfection, right? Then we have Trichomonas vaginalis. That guy is a protozoan. So we have a fungus and we have a protozoa here. So neither of these are bacterial that lead to vaginitis. We've already talked about the fungus for Candida, but for Trichomonas vaginalis, again, being protozoa, this guy is an overgrowth of microflora, right? This guy is a sexually transmitted infection. So you will actually get this from sexual contact with somebody who is infected with this. So Trichomonas vaginalis is a flagellated protozoa parasite. And so it can cause premature labor. You'll have a frothy discharge if you have symptoms. It's actually the most common non-viral STI, and it's not even reportable. It's so common that the CDC doesn't track it. So yeah, so like I have said previously, I worked at Southwest Integris and got a lot of hookers coming in to get tested for this, and a lot of them were positive. So it's definitely rampant. I think that's all I want to say about it then. So moving on to vaginosis. So now we have infection of the vagina, but not any true inflammation of the vaginal tissue with this. So this is like bacterial vaginosis, or BV. It's usually caused by a shift in like pH, and then that will cause shift in your microbiome, and the wrong bacteria will overgrow beyond like what your normal lactobacilli would normally take, maintaining your pH and your microflora and everything. This is often caused by overwashing with harsh detergents, so you don't want to disrupt your biome too much, wrong pH of cleansers, or just poor hygiene, so that we're not maintaining the proper levels of your flora, as well as introduction of new, microbes from sexual contact or close contact with others, and that sort of stuff. So BV, overgrowth of bacteria for this one, non-lactobacillus. I'm moving on to prostatitis. Of course, it's going to be for males. Males can get UTIs from, bacteria getting in through the urethra that could affect the bladder, but it could also move into the prostate. And that's usually what is going to happen is contact with enteric bacteria moving through the urethra and then into the prostate. This could be from your own flora, but it's more likely with males, it's going to be from just exposure to bacteria through the urethra from a sexual partner. That could be anal sex, oral sex, or vaginal, whatever. But anyways, it's usually not your own. More commonly, it's somebody else's flora getting into the urethra, but it is still more likely going to be E. coli than anything. So here we have true inflammation of the prostate and symptoms associated with that inflammation. Moving on to gonorrhea, we already talked a little bit about it, but I would like to point out that like the serious issue with this is going to be inflammation of the structures within the reproductive tract for women, especially women, because this can cause inflammation of fallopian tubes. And if you have inflammation of your fallopian tubes, the eggs can't move through the way that they're supposed to, especially once conception has started. So we can't get that, that embryo, essentially, a fertilized egg, to get through the fallopian tube and down into the uterus where it should implant. So instead, it gets stuck in the fallopian tube, and that's called an ectopic pregnancy. So this is considerably more common in these sexually transmitted infections where we have inflammation of the pelvic area, usually involving the fallopian tube. So that's called salpingitis. If you have that in the fallopian tubes, pelvic inflammatory disease is going to talk about inflammation of the uterus, the fallopian tubes, and tissues surrounding the area as well in response to this. This is all I wanted to say in addition to that, but this can definitely lead to blindness of babies that are born to those mothers. And other than that, we pretty much talked about all the rest of this. The inflammation that is associated with gonorrhea makes you more susceptible to other STIs like HIV. So that is important to remember as well. If you get one of these guys, you're more susceptible for any of these other guys for the most part. You often see chlamydia in conjunction with gonorrhea, which we mentioned. So that is not, shouldn't be news at this point, but you can have chlamydia, of course, separately too. So usually 75% of females with chlamydia are going to be asymptomatic. That's pretty terrifying to think about. But yes, but the ones that do have symptoms, it can be as bad as pelvic inflammatory disease and the things relating to that. So yeah, so chlamydia and gonorrhea, both of these guys are bacterial infections. They often go hand in hand. They have inflammation. Therefore, you're going to be more likely to be infected by other STIs as well. And I'm sure you guys can imagine, especially if we're talking about only up to 75% of chlamydia infections are going to be asymptomatic for women. Well, we're not talking about STDs, right? Because a sexually transmitted disease, you have pathogenesis and presentation of disease, but you can easily have these infections and still be contagious. And so that's why they changed the terminology to sexually transmitted infections and not diseases, because they don't want you to be confused that there's always going to be disease presentation. And I think that's a good move. Lymphogranuloma venereum just means that now you have this chlamydia disease and it can be spread to other tissues in the body and cause basically the inflammatory response like you would if you were sick with anything. So swollen lymph glands and things like that. Again, it's caused by chlamydia trachomatis, which is also associated with trachoma, most common infectious cause of blindness in the world. So this is just talking about sexually transmitted version, and that usually also usually associated with gonorrhea. Next is syphilis. It's one of the oldest sexually transmitted infections that we can think of. It's definitely an old world disease. In 1932, there was the Tuskegee study of untreated syphilis in the Negro male. That's what it was called. And it was a 40-year study where they had men sign up who had syphilis. They told them that they were going to get treatment, and instead they just watched to see what happens to them and let them die essentially from syphilis over time, so they could document, how syphilis could affect people, even though they had cures available for syphilis. So very highly, highly unethical thing that we don't want to forget that this kind of nonsense did happen. These men just couldn't read these contracts that they were signing, and so were basically conned into participating in these studies. So syphilis, let's talk about it. There's 3 potential stages. Also, there's a latency that you could go through where you don't have as much advancement of the symptoms. But first, you're always going to start with primary syphilis, and this is called a chancre. So chancres are anytime that you have a bump associated with presentation of a disease. Now, they can be painful or painless or whatever, but in the case of syphilis, you'll have presentation of one small raised hard bump that is painless, typically. That is the site where the bacteria entered in. And that's usually the first sign of syphilis. Most of the time, if you go to the doctor with a sore in the genital area or around the mouth or anus, depending on wherever you got exposed to it, the doctors now kind of can recognize that pretty initially right away as that's the chancre associated with primary syphilis, and you can get treated pretty quickly. So now we don't see a whole lot of progression to secondary or especially tertiary. Once secondary sets in, people are more likely to seek treatment, because secondary syphilis, you start having, like, you feel sick, you have lymphadenopathy, swollen lymph nodes, sore throat, and just fever and feeling sick. But now you're also getting a rash. It's a brownish rash that you'll get on, like, especially your palms, the soles of your feet, and like the trunk of the body. And that is pretty characteristic of the disease. You'll have mucus patches in the mouths and hair loss as well. So you can go latent during any of these periods of syphilis where you will have not any progression really of the symptoms. But if you move into tertiary syphilis, now we're talking about involvement of the nervous system and movement into the bloodstream, which will cause damage to the smaller arteries. You can have patches of like bruises and things like this, petechiae associated with that inflammation and damage to the blood vessels. Gummas will develop in other tissues that will be affected. Gummas are essentially like degrading tumors. So it's like a tumor-like area where the tissue is kind of being eaten away by the infection as well at the same time. It's not truly necrotic, but there are like open lesions associated with it. It's pretty disfiguring. Have you ever seen any like the old paintings of like old kings or whatever that had syphilis and they have like these sores on their faces? That's syphilis. It's nasty. It can progress to neurosyphilis, which is what we think a lot of like some poets and stuff where they'll talk about how they like turn to become have dementia later on in life. It's probably because of syphilis. And so headaches and convulsions, moving on into they say call it Argyll-Robertson pupil. So you'll have a blown pupil that doesn't respond at all to light anymore. And then of course dementia, and could even lead to coma and death eventually. Congenital syphilis is kind of just what it sounds like. You have a baby that is born to a mother that has syphilis, and it can be transmitted to the baby that way. And it can cause abnormalities in the fetus. So here are some images that are associated with the phases of syphilis. Image A, we have the depiction of that chancre that can develop, that small, hard, so relatively painless sore where the bacteria get in from the contact. And B, on the bottom there, that's the rash. That is that brownish rash that can be found on the soles of the feet, the hands, sometimes the trunk of the body. And then C, that sores that are on this gentleman's nose, those are the gummas that can develop as we move into the other tissues of the body. And here's a little baby that has congenital syphilis. It causes a lot of mucus to form in the mouth area and can cause birth defects as well. This is caused by a bacterium. This is Treponema pallidum. It is also a spirochete and has little hooks at the tip that help it adhere to wherever you are contacting the bacteria. The risk of infection for every sexual encounter with somebody, if you have unprotected sex with someone that has syphilis, the risk for infection is only 12 to 30% per sexual encounter. But still, I don't know that it's something you really want to risk, especially if you're going to have to go get treatment for this. It doesn't go away on its own, right? So you do want to use barrier protection like condoms. This will protect very well from the spread of this disease. It works well. And then, of course, penicillin is used to treat this. So you get a shot of penicillin G. And yeah, so we do have an increase in syphilis as people are becoming less and less aware of, well, needing to use protection really is what it comes down to. Yeah, I don't think this needs to be said, but just in case it does, birth control pills don't protect against STIs. Neither do IUDs and things like that. Only barrier protection is going to prevent that. So, and then even then, not in all cases, right? And we're going to talk about that in a minute. But anyways, moving on, chancroid. This is caused by bacterium Haemophilus ducreyi. This one has a chancre as well, but it's going to be soft and painful one. So it's kind of a more open, sore, gooey, sort of gross situation. Super painful for men, usually unnoticed in women, but if you have seen the pictures of this, I swear you would not understand how somebody would not notice this. But yeah, so it's supposedly not as painful, I guess. We usually see this more commonly in the tropics, associated with sex workers and poor hygiene. And uncircumcised men are more commonly infected, again, due to inflammation just associated with normal biome. You can treat this with antibiotics. All right, so herpes. Herpes, we've said it a million times, any herpes virus, whether it's HSV strains or talking about like chicken pox or mono or whatever, once you have a herpes virus, you have it forever. They hide out in your nerves. They can incorporate their DNA into your DNA, and they just kind of hide out like that. This is truth for genital herpes as well. So wherever you're exposed, the closest nerve they can hide out on and then re-express themselves as painful, really very painful vesicles, usually in the groin region. If this is genital herpes, if it is oral herpes, it's still the same viruses that can cause this. It's just on a different nerve, right? It's near the mouth instead. We've talked about how this could potentially spread. HSV1 is usually the oral one. HSV2 is usually the genital one, but they can kind of cause symptoms of both. Having HSV1 doesn't protect you from 2 and vice versa, right? So you're not protected that way. And there's no cure for these, but there are antivirals you can take to prevent outbreaks from this. What else I want to say? Just because you aren't having a visible outbreak doesn't mean you can't transmit herpes. There could still be residual viral shedding going on that we don't see. So if you do have herpes and you are treating it with antivirals, then good for you, but you still should probably disclose it to sexual partners. I'm just saying. There it is. For neonatal herpes, if there's any indication that you have had a recent outbreak from your genital herpes, whether that's current or you just had one recently, or you're showing signs you might have one, they will require that you have a C-section so that we don't expose the baby during birth to herpes. So herpes can become systemic essentially for the babies very quickly because they don't have the same immune system as we do. And if it gets into the nervous system, which is not uncommon, then it can have a 50 to 80% mortality rate. This is even with availability of treatments. So we don't want to risk that. So if anybody had herpes, definitely if they were having any presentation whatsoever, then we would want to move for cesarean section so we don't expose the baby, because once that baby is exposed, even if it does recover, it also has herpes for life. So that can be a true concern. Remember that herpes isn't just going to be associated with the vesicles, right? We learned that it can lead to the development of meningitis or even encephalitis, depending on if it moves into the nerves those ways, or even keratitis of the eye. So, cool. And outbreaks are usually caused by any kind of stress at all. You can see actual herpes virus infection in pap smears. You can see the inclusion bodies in infected cells. Even though pap smears typically are going to be used to diagnose HPV and not HSV, you can still see them present in the pap smears. All right, we are moving on to HPV next. So HPV, or human papillomavirus, causing genital warts and cervical cancer. There are over 200 different HPV viruses that can cause just warts, just in general, genital warts, or no symptoms at all, or potentially leading to cancer. So there's all different kinds of strains that can lead to those. Typically, the ones that cause the warts aren't going to be the ones that cause the cancer, and the ones that cause cancer typically don't cause warts, right? It's usually kind of one or the other. But the issue, of course, is you could have genital warts, and that can be some sort of disfiguring. And you can even have these formations of these condyloma acuminatas, where we have cauliflower-like masses of these warts developing on the genitals as a result. So that would be the HPV versions that cause genital warts, but you can also have the versions of this virus that can cause cancers. Cervical cancer, anal cancer, oral cancer, all sorts of different kinds of cancers. That's not even like the full list, but those are the more common ones that we might see associated with HPV. Males can also get urogenitourinary tract, I can't even say it, define that word, genitourinary, if they're going to write it that way, cancer from HPV infections as well. So this is not limited just to cervical cancer. Typically, if you have the cervical cancer related HPV, you don't have any symptoms. You're just going to be able to recognize it from pap smear, which is why pap smears are so important, and we need to keep pushing that women get those regularly. It's the only way really to diagnose HPV that could be relating to cervical cancer. The risk of cervical cancer has decreased dramatically over time, thanks to screening with those pap smears. But still, 4,000 women die each year in just the US from cervical cancer. This is not a joke. It's actually pretty serious cancer. And because we don't have a whole lot of symptoms, or symptoms that would be alarming, right? If you have vaginal bleeding, most women aren't going to be like run into the hospital immediately to get checked for cervical cancer. They're going to assume that that's spotting or some normal part of menstrual cycle or whatever. So these can go for a very, very long time, and then be discovered as like stage 4 cervical cancer, at which point there's nothing we can really do for the patients. So we want to be sure they're getting their pap smears regularly to screen for that. This is a great number of viruses that can be associated with HPV infection, but there's like I won't say handful, but like a good 15 or so that are associated with the cancers. These two, 16 and 18, are the most likely to be associated with cancer. And so when they do your screens for pap smears, they scrape the cervix and take those cells and actually run PCR to look for any indicators of the virus being present, as well as looking at them under a microscope to look for abnormal cells. Then we'll look for both of those things. So that's what the HPV will do for us now. If you go to your doctor and you're like, oh, always negative, congratulations, and we are all very happy for you. But as it turns out, right now, currently, this is our current, like, the updated numbers for about 25 to 46 of women under 25, okay, are infected with genital HPV right now, actively infected with it. Now, normally your body will clear it out once you have seen it, and probably 90%, if not more, probably closer to 100% of people who have had sexual partners have had at some point HPV. You may not have known that you had it, and your body normally, your immune system can clear it out over time, and all of your pap smears may have been normal, but you just didn't catch it, and your body just cleared out before then. If you ever had an abnormal pap smear, what they'll do is let you know it's abnormal, and then go in for a colposcopy, where they like basically look at the cervix, find areas that might be of interest, and take little pinches off of the cervix to look at those. If those indicate abnormal cells still, then they'll go in and biopsy larger areas and try to remove the abnormal areas from the cervix and screen for actual cancer, and try to catch it before we get into a metastasis situation outside of the cervix. So that's usually what the screening is for and what would happen. Needing colposcopies and having abnormal cells is actually pretty common. So if you are one of those people that's had to experience that, and I'm going to be honest, I was one of those people that had to experience that, you will usually, most people have limited need for treatment beyond the colposcopies as long as they catch it early. So that's the whole importance of the pap smears. And then your body can still clear it out. It's just a matter of time, making sure your body does clear it out before we have cancer development. So again, most people will clear it out eventually. You just don't want to be one of those unlucky few. There are vaccines that are available, different versions of Gardasil that can protect against different numbers or different strains of HPV. So there's the 9-valent, which targets 9 different HPVs that are associated with warts or cancers. There's also different versions that are like 7-valent, so only like 7 strains and what have you. And one of them recently got pulled off the market. I mean, I don't know why, but there's a big issue with it whenever we first came out with Gardasil, because they were pushing it for like the 13-year-old crowd. Mothers were like, well, my 13-year-old isn't having sex. Like, that's ridiculous. I don't need to be getting her a vaccine for sexually transmitted infection. Well, last time I checked, vaccines don't make you have sex, okay? Just by having the vaccine and protecting from your kid might be 13 now, but they're going to be 40 at some point. And I know that you think your little angel ain't going to get, lose their virginity until they're 40 and married and whatever. But the fact of the matter is, why not have the protection there for whenever they do start having sexual encounters, so that you don't have to worry about cancer being a possible byproduct, let alone, babies or something like that being the product. So that's kind of the argument for it. I feel like it's kind of irrefutable if you ask me. But having said that, they've now made it to where like pretty much anybody can get these vaccines, because if you've been exposed to HPV, you've probably not seen all the strains of it that could cause the cancer. And so they still will make this available to people who are like in their sexually active years now. It's just to protect against the other strains that you could potentially see. So it's not a bad thing to be trying to do that. So it is still recommended that you get up to 26, but then beyond that, it's kind of an optional thing. You could suggest if you think you're going to be having different, sexual partners or whatever, and you don't know, why not protect yourself against the cancer? Again, you can screen women with pap smears, but you can screen men too. It just involves a swab, but all of us women know for a fact that pap smears are not exactly the most comfortable thing in the world either for us. So, if you want to get into that discussion, we can happy to do that at a later time. Moving on, molluscum contagiosum. We talked about this in the skin disease section. It's a wart-like disease. It's usually associated in the Pacific Islands with, again, sex workers and unprotected sex and that sort of stuff, but we don't see a lot of it here in the US. It can be quite disfiguring for people with immune issues. Yeah. All right, then we have group B, strep colonization. So about 10 to 40% of women have strep, group B, beta hemolytic strep. as part of their flora. And here we're talking about streptococcus that can cause meningitis and pneumonia and things like that. So you don't want your baby to get exposed to it in the birth canal during birth. So they will try to screen for women late in the pregnancy to see if they have this bacteria normally, and they will try to treat for removing it from the flora if they can, if they catch it. But if they don't catch it, then we'll still be at risk for this. This is still a serious issue in women just today even. It's hard to always catch this. And the reason they screen so late in the pregnancy is because you could become colonized with this from any exposure, from normal day-to-day exposures anytime. So yeah, it can be very deadly. And so you want to be sure you get rid of that risk. For all these sexually transmitted diseases, I would like to point out to everybody the prevalence and incidence of HPV. For a prevalence, here we have 42.5 million people that have had HPV in the United States. Very easily, HPV is easily the most common sexually transmitted infection in the world. Again, most of the time you're going to be asymptomatic, so you might not even know that you've had it. And again, they believe it's over 90% of people who have been sexually active that have probably seen it at some point, just didn't even know. Sort of like we talked about with West Nile virus, like you probably had it and didn't even know. So it's like that, unfortunately. It can also cause cancer and genital warts, less concerningly so. But yeah. Yeah, and then of course herpes, not uncommon. This is another one that you would want to be clear with your partner that they could be getting exposed. The problem, of course, with herpes and potentially HPV, depending on the presentation of it, like if you have genital warts, you might not be protecting yourself with barrier protection like condoms, right? So you can have outbreaks of herpes like on the inner thigh. That's not gonna, the condom's not gonna protect you from that. So it's harder to prevent exposure to those sorts of infections when we have presentation outside of what typical barrier protection would provide us, but that's what we have. So just be open and aware of those diseases if you are somebody that has them, or if you're coming in contact with a partner that might have them. Look at that. So we're gonna do the questions. Yes, and you guys don't have to stand, it's fine. You know the drill. All right, Brittany, what's the most common cause of UTIs? Yeah, UTIs. So dehydration, but also, do you remember what bacteria is usually associated with it? I'll help you a little bit. It's a really common one in stool. Mm-hmm. Oh, sorry. Any guesses? E. coli for that one. Yeah. So there's that one, 80% of them. And then what, yes. What type of organism is Trichomonas vaginalis? Is it a virus, bacteria, protozoa, or helminth? This is Anaya. Yes, correct. Protozoa. And these are kinds of, some of the questions on the exams will be like this. Some of them anyways, for these diseases for Unit 4, a lot of them it's gonna be like this, because I just want you guys to get the basics down. So what pathogen causes syphilis? Certainly would be a lot easier if you guys had multiple choice for this one, but let's see if anybody can guess it, at least what type of pathogen it is. Kaylee K. Do you remember? Do you know what kind of pathogen it is? Virus, bacteria, protozoa, fungus? Which one's which at this point? Yeah. I'll help you a little bit. This is the one that had the 3 stages, where we had the chancre and the rash in the 2nd stage, and then the neurosyphilis and the gummas in the 3rd stage. Do you remember what kind of pathogen that was? All right, so this one is a bacteria. So it's Treponema pallidum for that one. All right, what disease is caused by Haemophilus ducreyi? This is a bacteria. Krista. Yes, exactly. So cancroid, chancroid, as long as you can recognize it on a multiple choice question, right? So you just luckily won't have to say that. I always feel like at some point in some semester, I'm going to subject people to that. Like, just like have like, yes, tell me, what is this organism? And that'll be like one of the questions for the test to make you guys say it. You guys will be long gone by then. All right, what pathogen is associated with cervical cancer? find people that are actually here. We have a lot of people that aren't here today, so it's not really helping at all. A lot of people that dropped that. Becky. Yeah, so that's an easy one. Most of us are aware of that, especially as women. So that's the last question, and that is the last lecture for the semester. So you guys won't see me again until the final, unless, I mean, I'll be, giving the reviews online, but you won't see me in person again until the final. So if you guys have any questions, be sure you email me. Does anybody have any questions about anything right now up front? You guys know kind of what to expect for the tests now. I've gone through and made sure that all of the questions on the test actually come from the study sheets. So there won't be any deviation from what's literally on the study sheets. You guys know that on my talks, especially like in Unit 4, I've talked outside of what's on the study sheets. You guys are going to see these diseases in the real world. And so I want you guys to at least be familiar with them. But as far as the test goes, it'll come from the study sheet. If you are looking at, okay, this bacteria causes diarrhea, but you want to put it in a perspective that separates it from the other ones that cause diarrhea, then looking a little bit more at this information can help you kind of delineate that. But as far as if I don't have it on the study sheet, that having it say this organism is gram negative, blah, blah, blah on the study sheet, then, I'm not going to ask you that on the exam. However, there is like in the diarrhea section on the study sheet, I say that Clostridium is the only one that was gram positive. So you should know that the other ones are gram negative. I mean, it's inferred in that. As far as the bacterial causes go, know for sure whether something is a bacteria or a protozoa or a virus or whatever, fungus, whatever that is. Definitely know those things about those organisms at the very bare minimum. And I would say if there is a disease that we talked about, like cancroid, know what that organism, be able to pick it out from a lineup of other organisms. I won't give you close spellings like Haemophilus ducreyi or Haemophilus ducreya or something stupid like that. I haven't done that before and I won't do it now. So if it is a list, it would be like Haemophilus ducreyi and Treponema pallidum and like Borrelia burgdorferi and random disease names. So you should probably at least be able to correlate those disease names with the disease they cause. Flashcard stuff, right? That stuff isn't like concept based. So if you're getting this stuff and you're looking at this stuff and you're like starting to be able to make flashcards or do Quizlets or whatever on these diseases, whether they're bacteria or virus or whatever, and then what diseases are caused by what, and then like serious, important factors like cholera causing rice water stools or something like that we've talked about, or that's on the study sheet, then you know that your time will probably be better placed studying units 2 and 3 and brushing up on that stuff because we know that stuff's pretty rough. So I won't have any more like necessarily difficult questions outside of what you're expected to know from the past exams. They will be different questions, but like, just shouldn't be like crazy bad worse or something. And I'll be honest that there will be some questions on the test, like I warned you about in the announcement, where you will have to understand a little bit more outside of just 1 unit's worth of information, be able to cross apply things. So if I ask you a question about what, you take a stool sample from your patient that had diarrhea and you see endospores, well, you might want to know which of the diarrhea ones cause endospores. Like that should be pretty obvious one, I feel like at this point, which would be C. diff, right? So Clostridium and Bacillus always had endospores. Even if I never said that in the study sheet in Unit 4, if I said Clostridium and Bacillus have endospores, then that was a Unit 2 thing, I believe. So you would have to be, or Unit 1 even, I think, be aware of that and be able to apply that from across units. That's a pretty basic example of it, but you get the idea, right? So a good portion of that's going to be a lot like questions like this for Unit 4 of like what type of organism, what organism causes that disease, stuff straight from the study sheet. So don't get too lost in the little details, please, while you're studying. Good. All right, you guys know how to reach me when you're studying. This is like the last day that you have a chance to see me in office hours. Outside of that, it's going to be you need to email me or create Zoom appointments if you need to help with something. I will have Friday. So no, I probably won't do a separate one for Unit 4. Just yeah, it's pretty. I feel like because it's so memorization heavy. Yeah, yeah, it's a fair question. But we will have it on the Kahoot questions.
Do you have open from
Units,
from reviews. I know that you have it from the sections, like if you have like chapter 1, then you have those open with that. But you remember, didn't you do like a separate review for each exam?
yes. So if you can't, I'll see if I can find them in my library, but for now, until I get to posting it, if you look in the announcements and can find like the announcement for that review and like, here's the link to it.
I'm not finding it.
Okay, I'll try to compile it together then.
Third one, you can only do it on our phone. And I have looked up like, 'cause it shows like, I know it's ridiculous, but I looked up like your name for the account or whatever to see if it would pull up like what you already had on. there.
Yeah,
It could be available, but it doesn't allow me to see it.
okay.
So,
Yeah, I'll compile them.
I don't know if you're aware of that.
It's not, it's fine. I'd rather you guys have the study materials. I don't mind doing it. I already have them made. It's just a matter of, yeah,
I feel like I'm always gonna be an option for some people.
yeah, no worries.
Awesome, thank you.
Yep, thanks.